So one exam, one answer, one course, the first free masterclass, first free crash course, whatever you call it. When I created that, the driving force, the passion behind this was my pain. Because I was exactly like you, where you are right now. I wanted to clear this exam because my life actually depended on it, you know. I just want to give you my background, right? My story. It might resonate with you, right? So I did my PT school from India actually. So I'm international trained PT now. Came to US. I knew I need to clear this one exam if you want to practice and if you want to, pursue this career or dream. When I saw this exam, man, I was like, this is really hard. I don't think I'd be able to do this because it's 5 hour long exam and you need to get the answers right every single time and a lot of pressure, a lot of things to get done. So I was thinking about it, what to do. Then I went to look into different courses, right? There's different courses available online and different books available, but these are like these big books and these big courses, 12-week program. You gotta follow a certain schedule for it. I mean, I don't know, man, this is what I want to do. And the biggest struggle was getting down to the two answers. The both answers look the same, both answers look correct, which you want to select. And I, most of the time, I made the wrong answer, choose the wrong answer every single time. So I knew this is not the way it should be done. So that's why I created a system that will help someone who is going through exactly the same kind of problem that I was going through. That's why we created this one exam, one answer, one course. We don't want another course. We don't want another thousands of courses or 12-week program or on the different books. You need only one course to understand the system behind it to get this corrected. So I'm a licensed physical therapist here in New York and the founder of NPTE Strike. But before this license and title, I was exactly where you are right now, struggling. I remember sitting behind a mountain of textbook. I was feeling overwhelmed by 12-week study schedule that felt more like a marathon. It was stretched out than a surgical strike kind of preparation. You were not striking on the right points. I wasn't failing because I wasn't smart enough. I think I'm smart, so smart, or because I wasn't putting in the hours. I was failing because I was trying to memorize this entire profession instead of understanding how the exam actually work. Understanding how the exam, how this game, how the rule of the game need to be played is a very important thing. So I realized that NPT isn't a memory test; it is a clinical reasoning test, and that's why I created this system. I moved away from the 12-week grind, developed this framework built on clinical logic. So it's the same system I used to clear my board exam. It's the same system that transformed me from a stressed candidate into a licensed PT here in New York. So at NPT Strike, we don't just give you more fact to memorize, right? We give you the clinical lens. You need to dissect any scenario that been thrown to you. So let's start this overwhelming story, and it's time to start your career. So welcome to NPC Strike. Let's get you licensed, right? So I want you to keep this in mind. This masterclass transform NPT preparation from teaching decision making, not by memorization. So decision making is what really matters, not just in exam but in life also. Okay, not you don't want to memorize a lot of things, and by the end of the class you're going to master the ethics and professional responsibility part also from the curriculum of NPTE exam. So before we dive in, I need to understand something really, really important. This is not another content lecture, right? I'm not here to throw more information. You all did that in your 3-year DPT program, right? Or your PT school, wherever you did that. So I'm not here to make you feel like you need to memorize more stuff. Let me be very clear about what's happening in the next 60 minutes. I hope I can be able to complete in next 1 hour, 60 minutes. I'm going to show you how the NPT actually thinks. And I mean that literally. Literally, how is NPT want you to answer these questions. So NPT doesn't test you what you know. Okay, they don't test what you know. It tests how you think under pressure. Under pressure, how you're going to, so there you have 1 minute to answer one question. Now how you're going to answer the right answer every single time. That's what they're going to test, not what you know content wise. So if you ever had that feeling when you're taking a practice exam, you think to yourself, well, I was like this, I know this material, I know this, I studied this, but I keep getting these questions wrong. If that is you, you're exactly where you're supposed to be. Okay, so here what happens to most students: you read the questions, you narrow down into two answers, and then you're starting to panic because you do second guessing, or you overthinking, and you pick the wrong answer. This was me. So I was like, okay, I knew this is not going to be the answer. Then I come down to the last two answers, and in that two answers I will be like, what do you think is the right one? And I made the wrong answer simply by guessing because I didn't knew what NPTD wanted out of me. Okay, so if you, is this sound similar to you, this is not a knowledge problem, this is a decision making problem, and that's what we are going to fix today with this course. I want you to type in chat or in the comment box, or you can note down this. Okay, I knew that material, but I still got it wrong. If you are someone who resemble with this kind of problem, you're in the right place. Okay, can you? If you are in the comment box, I want you to type in. I went through the same problem. I knew the material, I knew the content, but I still got it wrong. So most of the students, when I talk with them, they experience the same problem, right? So the NPTE intentionally designed to make you feel that way, right? It designed to create that confusion. But once you understand the logic behind it, the confusion disappears, the guessing stops, and you started to getting the right answer. So let's look into what is this two answer trap. Let's talk about the reality right now. So you invested thousands of dollars, years into this education. You got this DP degree, you're graduated. You spend years learning manual testing, grades, gate cycles, cranial nerve assessment, drug class pharmacology, drug classification, every single special test known to human being, to every single giant, right? I mean, you know the stuff. I'm not questioning that. You already know the knowledge, but then you sit down for practice exam, in questions after questions, you find yourself stuck between these two answers. And it's not random, it's predictable. It happens on the hard questions, it happens on sometimes on the medium questions, sometimes it even happens on the simple question that you should definitely know. So here is a question for you, man. If you know the content, why you are still missing the question? So I want you to self-reflect this time. You need to ask the questions to this yourself, right? I want you to think about the last time you were stuck between the last two answers on a practice exam. What did you feel in that moment? Are you panicking? Like your mind went blank? Or are you self-doubt? Like maybe I don't know this well as I thought? Or you're overthinking it? Like you're reading too much into it. And this is all the thing. You like think too much, you create your own stories in the mind and get things wrong. Or you are guessing. Like you just picked one answer and hope for the best. Hope is good, but what if the guessing goes wrong every single time and that lead to failure? So, you know, so if you were saying any of this, that make a perfect sense, right? This feeling is created by this exam on purpose. This is not an accident. A lot of students go through the same stuff, and I also went through it. So NPT is not testing your memory, right? You're not testing the memorized textbook. It is testing if you can make right clinical decision when you're uncertain, and that's completely different skill. So here is the real problem, and I'm going to say this as clearly as I can. Okay, this is a problem a lot of students face, and I faced too. Let me explain what I mean. So when you were in school, your professor tested you on what you know, like what's the stages of bone healing, what muscles are innervated by radial nerve, what's the normal range of motion of shoulder flexion. All of this is needed. These are knowledge questions, and you're good at this because you trained and you already graduated them. You trained this 3-year program, right? You went through it. You all have this knowledge. But NPT don't doesn't ask those questions. NPT asks, given this patient scenario, what would you do first? Given these red flags, which one require immediate attention? Given the ethical dilemma, what is the most appropriate response, right? You see the difference? It's more practical, it's more application based. It's not going to ask what nerve is supplying this muscle. They're not going to ask you that, right? So textbook is like an encyclopedia. It gives you all the information organized by the topic. But NPT is like an emergency room. You're in the war room. You're in emergency room. It gives you chaos, and you have to decide what matters the most. What is the priority? Priority. What is the safest decision? Right? To get you into that perspective, let me give an example. Imagine you're working on an ER and three patients walk into that ER room same time, and the patient one is yelling, saying, "Oh God, my shoulder pain! Help me! Help me!" The second patient is sitting quietly, but he is sweating, and he is chest. Patient three is asking for direction to the bathroom. Who would you help first? I mean, obviously you're going to help the patient two, right? Why? Because he's showing some cardiovascular symptoms there. He's sweating, clenching his chest. Even though patient one is yelling louder, doesn't mean that's the right answer. Patient asks you a direct question, where is the bathroom? That is not also the right question. You need to prioritize based on severity and urgency. That's the whole logic. NPT logic. You don't treat the loudest symptom, you treat the most dangerous symptoms. And once you understand that, everything changes. So NPT is basically tricking you to select the wrong answer, but you're saying, I'm not going to fall into that trap. I'm going to select the right answer. No. Here is what I'm giving you today, man, with the surgical strike method. And it's not about memorizing the more content. It's about eliminating the wrong answer faster so that you stop guessing and start selecting with the confidence. So people think this one, okay? They think that you need to select the right answer. That's not what you need to do. You actually need to know how to eliminate the wrong one. You need to cut out the wrong signals and focus only on the right signal. And this is a principle of life too. There will be a lot of people telling a lot of things in your life. There will be a lot of things going on, but if you can focus on the right signal, you'll be able to succeed in life. And the same thing principle goes to the MBT also, right? So let me explain how this works. Right now, when you see a question with the four answers, your brain is trying to figure out which one is right. You're looking for the correct answer, and when you two answer seems right, you're getting stuck in that two answer, and then you start overthinking, making your own story, and then end up guessing the wrong one. But surgical strike method flip that. Instead of trying to find the right answer, you eliminate the wrong answers. So if you take everything wrong out, then you end up with the right answer. So you don't need to choose the answer. That's obviously going to be the right answer. So you do this systematically, and then a logical pattern that repeat on every single exam. So once you learn the system, you can take that system and implement that in every single question, and then you can succeed in this exam. By the end of today, you're going to know exactly how to spot safety violations. So we are going into professional responsibility and ethical part of it. Identify autonomy violations and cross them out without hesitation, and recognize the scope of your practice and its errors and remove them from consideration. So here is the best part. These pattern, once you learn the system of eliminating the right way, it shows going to show up on 60 to 70% of the exam questions. And that means you can apply this method, if you learn this method, to majority of the exam without memorizing a single new fact. Okay, so you're not going to study more, man. You're going to think smarter, because I was thinking when I started, I need to know more. You need to actually know less, and you need to know how to do it smarter. So it's not about just working so hard, it's about working smart. And that is what we're going to do with this NPT strike. So you're already doing a surgical strike. You are looking for the exact spot that you want to hit, not bombing everywhere and end up losing the war, right? Now we are entering the professional responsibility and ethic part of it. We're going to go through the first principles of this one, ethic part of it. Okay, so this is a scenario based teaching. By the end of the program, you're going to be skilled in answering the professional responsibility and ethic part of it. And after that, we're going to talk about the contents that you need to really focus if you want to master this program. Okay, look at my Apple Watch shining. It's not Apple Watch, it looked like an Apple Watch. I don't know. Okay, so introduction to the professional responsibility. All right, so let's get into the core of this master class, right? And I wanted to keep this completely free to make sure that one who take these classes should know that this is a style we're going to learn, and we only want people, students. I don't want to call people, I mean that's such a generic name, right? Students or professionals who are ready to be licensed physical therapists, who are right fit for this program. No, I don't believe everybody is the right fit for this program, because now if you lack knowledge in the sense you don't have the content, the issue is might not be the selection, right? So I want to make sure you already have that knowledge of 3 years education, and then you're now connecting this issue of two ends a trap, then you are the right prospect, okay, of this program. Otherwise, I recommend you go for the three big three part of it. That will help you get the knowledge, the content of it, because we are going deep understanding of the knowledge in that one. Okay, so we go through ortho, neuro, cardio, and non-system, another system, everything. We going like 10 hours straight class. This is a crash course, man. 10 hours we going straight with that, for that course. But that's what you should be doing if you are feel like that knowledge part is also, you have some work to do, or you feel like you need to refresh whatever you studied on the for DPT program. Okay, so all right, so let's get into the score of this masterclass. I'm going to teach you something that most NPTE prep course completely miss out. Okay, professional response in ethic questions are the highest return on investment point on the entire exam. So let me say that again. Ethics questions are the easiest points to secure if you know the pattern. Understanding pattern in life is very important. Here is why. First, these questions repeat, right? NPT can't ask you million different ethics scenario because there are only so many ethical principle legal standards. So they ask same type of question over and over again with a slightly different wording. Now, second, the logic is consistent. Unlike clinical questions where you need to know specific protocol or specific condition, ethic questions follow universal rules, and patient safety comes first. Autonomy always matters. Confidentiality is non-negotiable, and document protects everyone. So these ethic and professional responsibility revolve around these principles. I want to tell you again, right? Patient safety is always first. There's nothing above patient safety. Autonomy matters, always matter, right? Confidentiality is non-negotiable, right? Document protect everyone. Keep that in your mind. All things. Okay, autonomy, patient safety, documentation protect everyone, and confidentiality is non-negotiable. Third, emotion tricks the students. So a lot of these questions are, they want to trick you. So while they add some salt, some pepper, to add some emotions to the question and see whether you are going to choose the wrong answer. So when you read an ethic question, your instinct might be to do what feel compassionate, right? What you feel, or what feel professional. Feel. I want you to. I'm going to make it more bold. The feeling part of it is very, very tricky. They make you feel something, right? But the exam doesn't care about your feelings. The exam doesn't care about your feeling. It cares about the legal and ethical standard of care. So if you can remove emotion and start applying logic, these questions become automatic points, right? So with ethics and professional responsibility, you need to step out of the feelings and understanding the logic behind it. Not just in exam, man, this in life also. You cannot always feel things. Sometimes you need to walk away from some people and break up with some people to make your life back on track, man. That it is what it is. I'm not going through a breakup, I'm just telling you, feelings. Okay. So if you can remove emotions and apply logic, these questions become automatic points. Now, FSBPT, that's Federation of State Board of Physical Therapy, the organization that create NPT, they are specific category called professional responsibility. Okay, this is a huge category. It covers everything from documentation standard to patient right, from billing practice to cultural competence, and from telehealth reporting obligations. So these things are what these content considered of. And here is the thing: students often skip this material because it doesn't feel clinical to them. I tried to skip it, but then I understood, man, this is easy points I can get. Why should I skip it, right? It's not so sexy, but it's not manual therapy techniques or exercise prescription. But I'm telling you right now, this category can make or break your exam. I'm going to stress that again. This category can make or break your exam. Why? Because these questions have clear right and wrong answers. There is no gray area. Either you know the standards or you don't. And once you know the standard, these become free points. Don't waste it, man. Today I'm going to walk you through the core concept of professional responsibility using real scenarios, not boring legal definitions, real stories, real situations you will face on exam and in practice. So I told you, you need to know the rules to win the game. Like that, you need to know what they're going to ask if you want to master the ethics part of. So we're going to cover 10 major category with the 28 scenarios completely free for you, my friend, because I want to make sure no one goes through the pain I went through, and I really want to help, man. My light just went off. Okay, so the major, we're going to cover the 10 major categories with the 28 practice questions scenarios. Okay, so the first one you need to know is the patient right and autonomy. You need to know what's the right and what autonomy they have, right? And you need to know the documentation standard, very important, legal protection. Then you need to know the confidentiality and HIPAA. Then you need to know mandatory reporting obligations. You need to know the scope of the practice and team role. You need to know billing, coding, and fraud, huge cultural competence, social economic factors, human resource and workplace safety, and risk management and quality assurance and technology, EMR, and telehealth. So this is not just for the exam, bro. It's so important to know in daily basis also, if you want to protect yourself, not falling into any legal battles or something like that. High stakes, not for exam, but in life also. I know this sounds like a lot. I mean, it sounds so boring. I don't know. Some of the people may not even be made to this end. Right? This is 20 to 23 minutes. So this might sound so boring, but I'm going to show you the pattern. By the end of this section, you will be able to spot these questions types instantly and answer them with confidence. Okay, so let's start. The first category is patient right and autonomy. Okay, so this is, let's go with the story. A story is very important. I mean, my grandma used to tell me a lot of story, and that's the only thing that made me fall asleep. So you're going to probably sleep. I don't know. I mean, I can't try to make it as interesting as I can with the story. So let me tell a story. A true story that happened to me in my first year of practice. This is really happened. Okay, I had a patient. Let's call her Mrs. S. Rodriguez. Rodriguez. Did I say it right? Who was recovering from a total knee replacement. She was doing great in therapy, making a lot of progress, regaining her range of motion, getting strong, right? And one day I walk into the treatment room. I'm all set to start our exercise. I have got the plan, and I know that we are doing what we were doing. And Mr. Rodriguez look at me and say, "I don't want to do therapy today. I'm tired. I just want to go home." Now here's what I was thinking in that moment. She needed this therapy. If she skipped today, she will lose progress. I am the profession here, right? I know what's best for her recovery. So what do you think I did? I tried to convince her and I said, Mr. Rodriguez, I understand you're tired, but consistency is really important right now. If you skip today, it's going to set you back. I was trying to be encouraging, but I was also being a little pushy. And you know what she said? She looked at me and said, I didn't ask for your opinion. I said, I don't want to do therapy today. And that's when it hits me. She was right and I was wrong. Right? Here is the core concept of patient autonomy. Competent adults have the right to refuse treatment, period, even if it's a bad decision. Your job as a PT is to not force compliance. Your job is to educate, respect, and document. Okay, so let me show how NPT is going to test this. Okay, a 72-year-old patient with a recent hip replacement refuses to use gait belt during ambulation training. The patient states, "I don't need it. I don't need your gait belt. I have been walking fine without it at home." What's your most appropriate response? Remember, not by emotion, by the rules, by the logic. So option A, insist the patient to use the gait belt for safety and refuse to proceed otherwise. Proceed with ambulation training without the gait belt since the patient is competent. Educate patient about fall risk and document their informed refusal if they decline. Contact the physician to override the patient decision. What do you think is the right answer? Everything looks so good, right? Everything looks so good to select. Would you pick A? Would you pick B? Would you pick C? Or would you pick D? I mean, insist the patient use gait belt for safety or being a little pushy there, right? Proceed with the ambulation training gait belt since the patient is competent. It's a little risky there, right? Educate the patient about the fall risk and document the informed refusal if they decline. Sounds like a good one. But contact the physician to override the patient decision. There can be also an option, right? So now you're in this point of making that decision. Man, this can break or make your exam. Now, the right answer is educate the patient if they decline. Let me make it a little green there, okay? That's the right one. If you made this right one, good job, good thinking, good logical reason. Now we need to think why you made that. The question tests your understanding of informed refusal. Patient has the right to refuse gait belt. Patient has the right to refuse the treatment. You can force them with any of that, right? You can refuse to treat them unless you genuinely believe there is an imminent danger. But you do have a professional obligation to educate them. You say, I understand you feel confident, but I need to explain that hip precautions are still in effect. And gait belt provides an additional safety in case you lose your balance unexpectedly. Without it, there is a higher risk of dislocation or injury if you fall. Now you already educated the patient, right? Then patient has the right to make a decision on it. Then you assess their understanding. You ask, can you tell me what the risks are if you fall right now? If they can articulate the risk and they are making an informed decision, then you document. Documentation is say very important for everyone. Patient educated on benefits of gait belt use and the risk of ambulation without assistive device. Patient will know all the risk and benefits. Patient was verbalized understanding and still declined the use. Patient proceed with ambulation with the contact guard assist. No adverse event. If there is an adverse event, you need to know that also. So that is an informed refusal and it protects both you and the patient, right? So why the other option went wrong? So this is very important. You need to know why you eliminated other one. So option A is wrong because it paternalistic. You're treating the patient like a child. The option A is wrong because you're treating the patient like a child. You're being a little pushy. Option B is wrong because you skip the education. You need to make sure in the B, proceed with the ambulation training without gait belt. So patient really don't know the why you were telling to put the gait belt, right? So education you skipped. Option D is wrong because physicians don't override patient autonomy for safety device. Okay, patient has autonomy to make that decision for themselves, not physician, not you or someone else, right? So I hope you got it. Good. Now let's look a related but different concept. So that was patient autonomy and informed refusal. Now, medication non-adherence. So patient with the multiple sclerosis tell you that you have stopped taking their prescribed disease modifying medication because they read online that is toxic and they prefer natural supplements. What is your most appropriate action? Ooh, respect their decisions. This is their personal choice. Encourage them to reconsider the warn them about disease progression. And contact the neurologist to report medication non-compliance. Educate about risk. Document. Encourage discussion with the prescriber. What do you think will be the right answer? Everything is right, but to look for the sorry most appropriate action. Okay, what will be the most appropriate action here? Okay, so A, B, C, D. Think about it. What will be the right appropriate action? So that multiple sclerosis, they need to take medications, but they read something online, right? Everybody go for online education and think they're toxic. Now they are taking some natural supplementation. What do you think will be the right action? So this one is a tricky one because it involves medications, that directly don't come under your scope of practice, which is outside your PT scope. But here is the key: patient have the right to refuse medication, but you have an obligation to ensure they are making an informed decision. So this is a very important concept. Everyone has the right to say, I don't know, man, I don't want to do that, but only after they are educated. Make sure what is the options, what are the available options, what is good, what the thing is right and wrong, then they can make. So educating them is very important. So obligation they are making informed decision and to facilitate communication with the appropriate provider. So right answer, most probably you all got it right because it seems obvious. I don't know if I got that word right. So educate about the risk, you document and encourage a discussion with the prescriber. Okay, because these correct, you respect their autonomy, you're not forcing anything, right? You provide their education within your scope. You discuss how medication management affect rehab outcome. Multiple sclerosis and medication timing is very important. You facilitate appropriate care. You encourage them to discuss with the prescriber, the person who can address medication concerns, and then you document. So you protect yourself legally, right? So educate about the risk. You need to document, encourage them with the prescriber. Okay, so that will be the right action. So here what you would say, understand you have concern about your medications. That's something you will want to discuss with your neurologist, as they can address a specific risk and benefit. From a therapist perspective, I can tell you that disease modifying medication can impact your energy levels and your response to exercise. So it's important that your whole care team know about any changes you're making. Would you like me to help you schedule a follow with your neurologist? That will be the right way to put that in. Okay, so you're not being pushy, you're not making decision for the patient has autonomy. You're just educating the patient and telling this might be the good option for you. You have the right to make decision, so they are making the informed decision. And make sure you document. Option A is wrong because you're abandoning an responsibility to educate your patient. Option B is wrong because it's outside your scope to warn about disease's progression from stopping medication. Option C is wrong because non-compliance has negative connotation and you're reporting without educating first. So contact neurologist to report medication non-compliance. That's not the right thing to do. Okay, because non-compliance has a negative feeling to it, right? And you're reporting without educating the patients first. So you see how nuanced this is, right? The exam is testing whether you understand the balance between patient autonomy, your professional responsibility, and the scope of the practice. So every answer might see, if you look at this one, the answer, everything look this, you can be right, but what is most right, right? How to prioritize the answer, that's where the skill is. So you need to educate the patient. Patient has right to make autonomy has patient has autonomy, informed um, decision making, and you need to document anything that you're doing, so that will legally protect everyone. So then we are going into documentation against patient wishes. This is a very important one. So if patient asked you not to document a fall that occurred during the therapy because they are worried their insurance will drop them, what should you do? So they are testing again the emotions, right? You can be a little empathic to the patient and be like, I don't want to document, man, that I don't want to cut this insurance off, right? So patient asks you not to document a fall that occurred during the therapy because they are worried their insurance will drop them. What should you do? Honor the request to maintain therapeutic relationship. Document the fall but omit details to protect the patient. Explain that you're legally required to document all adverse events. Tell the patient that you need to report this to their insurance company. I mean, most of you already know that you need to know. See, you look like a good answer, but sometimes the therapeutic relationship is also important. You don't want patient to feel bad, so you can do A also, right? Sometimes maybe this is not good too. Tell the patient you need to report this to an insurance company. Threatening the patient. Okay, think about it. What will be the most appropriate decisions? I mean, most of the students might have got this right. The C. So the answer C. This is a huge concept. Documentation is a legal requirement, not a negotiable courtesy. Okay, understand. So how will you say this? I understand your concern, but I'm legally and professionally required to document all events that occur during the treatment. Documentation protect both of us. It shows what happened, how we responded, that you weren't inquired, that you weren't injured. Not documenting could actually create a legal problem for both of us. If something comes up later, your insurance company don't receive my daily notes. They only see summary reports, and even if they did, a fall during therapy doesn't automatically mean your coverage is at risk. You actually show we are providing appropriate care and safety measures. Documentation is a must. It's a legal requirement. I want you to write this in your heart deep down. This is protecting you and the patient. It's a non-negotiable at any point, at any cost. Okay, why the other options are wrong? Option A is wrong because you're violating professional and legal standard. You're becoming emotional. You need to put logic and laws into and legal standards to it and be more professional. Option B is wrong because partial documentation is falsification. Man, you're gonna be on the court for that. Option D is wrong because you don't report directly to insurance unless there is a specific claim or a request. Okay, so the core principle documentation protect everyone, every single one of us. It's the basics of the whole program, whole plan, right? Alright, document truthfully and completely. Alright, that's the patient right and autonomy. Let's move to now documentation. So you need to documentation. So now you need to look into documentation standards. So let me tell you something that will save your career. Okay, if you do not document, if it's not documented, it doesn't happen. It didn't happen. Very important concept to understand. I'm sorry guys, my light is dead, but we need to continue the class without the light. I hope you will forgive the darkness. Okay, so if it's not documented, it didn't happen. That's what you need to understand. So this is a golden rule of healthcare documentation. The NPTE tests this constantly. And here's the scenario. I see this in practice all time, and it trips up student because they think their emotion instead of their legal brain. So with ethics and professional responsibility, mainly they don't to put you into the emotional track. You don't fall into that trap. You falling into the logical part of your brain. Don't let the monkey brain rule over you. Okay. During a treatment session, a patient report that they experienced So this is a late entry on documentation. So during a treatment session, a patient report that they experienced increased pain after their last visit. You review your previous note and realize you forgot to document the exercise you prescribed. What is your most appropriate action? This usually happen on daily basis. You know what I mean? Big thing you need to know. So what are you gonna do? You missed something. Patient came here with a pain now, and you feel that there's no documentation of the exercise you did last time. So what you can do, add the missing information to your previous note. Now, document in today's note that exercise were prescribed at the last visit. Add a late entry to previous note with the current date and reason. Say nothing since you remember what you did. Okay, everything seems possible, but what do you think is the most appropriate action? Like again, that most appropriate action. Okay, if I was you, I'm going to look into option C. Let's see if option C is the right answer. Option C is correct, I told you. I mean, most of you probably got the right because now you're coming into the track, okay? Answer C is because this is just a critical concept. Late entry must be clearly marked with the current date and reason for late entry. Okay, you need to say why you made a change in the documentation. Why? Because healthcare documentation is a legal document. Every documentation, healthcare is a legal document. It's going to protect you, patients, and everyone else involved in it. You need to take it so serious. It can be subordinated in court. If you go back and add information without marking it as late entry, it look like you're falsifying the record. That is fraud. That can cost you your license. Think about that. Making a change in the documentation without properly noting it down or giving the reason for that can lead to loss of your license that you're working so hard for, man. If you go back and add information without marking it as a late entry, it looks like you're falsifying the record, and that is fraud. That is going to cost your license. Okay, so here what you do, you open your previous note, you add a clearly marked late entry. Late entry, you put the date, and you're going to exercise prescribed at your previous as included. This one, this information was inadvertently omitted from the original documentation. That's how you're going to write it. Then in today's note, you document patient report increased pain following exercise prescribed at last visit, exercise reviewed and modified as follow. Okay, so why you need to eliminate the other one? Option A wrong because it backdated without disclosure. This is falsification. Option B was wrong because it doesn't correct the previous record. Option D wrong because if there is ever a legal case, I remember is not a defense. If you go to court and say that, oh, I remember that, they'll be like, oh hell no, where is your legal document? Legal documentation is what? The documentation you're doing, okay? That was going to protect every one of us. Keep this in your heart. Never forget till the day you die. And all the day you'll be in the profession. Documentation protects you and everyone else involved in. Got it now? So now let's see another documentation trap. So option is A is because you're missing the information to your previous note. So that is not backdating without disclosure. It's a falsification if you do that. Option B because it doesn't correct the previous record. You only add on today's one. That will be wrong thing. And say nothing since what you did. Remember what you did. You cannot defend yourself in the court if something goes wrong. Now, you're going into something mandatory clinical documentation. Now, if you're treating a patient who mentioned there have been some chest discomfort during activities at home, but they didn't want you to make a big deal out of it, they refused to let you document it, what would you do? So again, they're putting some emotions into it. So what are you going to do? Honor the request and you don't document to maintain trust. Document the report and your clinical response regardless of their request. Only document if the patient gives written consent. Call their physician immediately without documenting. So mandatory clinical documentation, that's a heading. So what are you going to do? I mean, a lot of people who are so empathetic, so emotional, is going for the honor the request and don't document to maintain the trust. this is going to be a nasty disaster for you. Okay, I mean, most of you already thinking the obvious answer. Okay, so if you guess it right, B is the right answer. Okay, you cannot decline document relevant clinical information based on the patient preference. Patient cannot say, can you document that? Can you don't document that? Here, the power of documentation shifting to you. Patient has some right. At the same time, you have some responsibility also. And that is your responsibility to document everything that is going on. When a post-surgical patient reports chest discomfort, that's a red flag. That could indicate pulmonary embolism, a cardiac event, or other serious complication. You must document it. Okay, you must document it. Here is what you say to the patient. I understand you don't want to worry, you don't want to I understand if you don't want to worry anymore anyone, but chest discomfort is something I'm professionally required to document because it could be related to your recovery. I'm going to document that you reported this, and I'm going to recommend that you follow with your physician. This is for your safety and mine. So maintaining the safety and safety of both party documentation, especially such high stake, not especially, I don't want to use especially, document everything that possibly should be in document. That is a legal documentation, that is to protect your license. Think about like that. If you want to protect your license, you need to document, right? So, and what you're going to document: patient report intermittent chest discomfort with activity at home, patient hesitant to seek medical follow-up, patient educated on potential seriousness of symptoms, recommended urgent evaluation by PCP or ED if symptoms worsen or accompanied by shortness of breath, diaphoresis or radiating pain, patient verbalized understanding. And yes, depending on severity, you might also need to contact physician directly. Okay, so if there is a seriousness of the issue, that you probably need to contact the physician also. So the right answer is B, document and report and your clinical response regardless of the request. Option A is wrong. Why? Because never omit the clinical information that can be fraudulent. Option C is wrong. You don't need consent to document patient report. You don't need patient consent to report to document anything. Okay. And D is wrong because document first, then comment. First, remember, you don't want to first call the physician and then document. First you document, then you call the physician. Okay. One more documentation scenario, and this one is about electronic medical records. So EMR security and credential sharing is a huge. I mean, HIPAA, if you know HIPAA, this is huge in the game. And not just for the exam, even if you're practicing in outpatient clinics or hospitals or wherever you are, the patient information is huge. Okay, so EMR security, electronic medical. Okay, so this is huge in the game. So let's look in the question. You're running late. You're for your next patient. You're completed Mrs. Johnson's treatment, but you haven't documented yet. So you log on to EMR, your electronic and medical record, using your credential, but step away from the computer. Your PTA offered to type up your note while you see the patient, while you see the next patient, using your login. What should you do? This is a huge thing. I mean, this can happen on daily basis too, right? You get really busy and you say, the PTA offers you, I can do the note for you, so you can see the next patient using your login. So what you should do, you can allow PTA to type the note, since you will review and sign it later. Log out immediately and document note yourself later. How the PTA document under their own credential with a cost signature. Document abbreviated notes now and then complete them later. So if you let PTA do it by themselves from your account, man, I don't know, that can lead to serious issues. Okay, so what do you think will be the right answer? Everything can be done, but what is the most appropriate steps to take? Log out immediately, document note for yourself for later. So human security and documentation integrity is very important. Now, here is the rule: never share your login credential and never allow someone to document under your credential. This is huge. Okay, so what happens is, if you let someone to I'm getting sleepy too, bro. I want you to stay till the end of the program. But so what happens if you let anyone else do from your account, right? Because when you sign a note, you're legally certifying that you performed and you documented that care. If someone else types it, even if you review it, you are still responsible for anything that in the note. So if there's an error, if there's a lawsuit, you can say, well, I didn't actually type it. Right? This is a legal document. Take it serious. So that's bring with a lawsuit for you. So that's why you don't want anyone else to type your note. Plus, there is a violation of your security policy. Most facilities have policies that sharing credentials around is a ground for termination. So you get kicked out of your EMR too if you do that. Okay. So option A is wrong. Credential sharing is prohibited. Option C is better, but still problem because PTA didn't perform your examination and evaluation. So even if you have the PTA document under their own credential and they didn't do it, there can be another issue. So option D is acceptable if your faculty allow interim notes, but option B is the most legally sound. Okay, so this is also a good option, but the most appropriate and most legally sound one will be log out immediate, do it by yourself, and then you're signing in, so you are legally obligated to that. Okay, so the core principle: protect your documentation integrity like you protect your license, because they are connected, right? So protecting your documentation and maintaining a standard is making sure that you're protecting your license. All right, so that's documentation. Let's move to now HIPAA confidentiality, which is a huge one. Okay, now we are entering the HIPAA and confidentiality. If you're making it till here, I want you to take a break, drink a tea, or now drink something, eat some snack, don't sleep, stay alive. Because we are entering high stake part now, HIPAA. Okay, HIPAA confidentiality is huge. I just made my mic sound so good. Okay, so story introduction, man. Now we are going to talk about something that shows up on NPT constantly and HIPAA violations, and I'm going to tell you a story that make this real. I was working in an outpatient clinic, okay, and during the lunch, I was in the break room with a few colleagues. So one of them started talking to me, and so they started talking about me, this patient, and let's call the patient Mr. Davis, who was a local celebrity. So my colleague is describing his injury, his prognosis, laughing about something funny he said during the hearing, and I was, I remember thinking, this is entertaining, but this is also illegal, right? The break room wasn't private. There was other staff members there, front desk, billing people who had no clinical role in patient's care, and that is HIPAA violation. So here is what HIPAA violation actually means. Okay, there's something called PHI, that's called protected health information, can only be shared with individuals who have a legitimate need to know for the purpose of treatment, payment, or operations. Patient protected health information. Okay, only three people has the right to know it: the one who is treating, the purpose of treatment, the payment, insurance, right, and the operations related to that. They are the only, you cannot discuss a patient's case or anything about them in a public space or in an open space like that. That is HIPAA violation. That is illegal. Let me show you how the exam going to test this. So public HIPAA violations. So you are in the elevator with a colleague when they begin discussing a patient's HIV status. There are two other people in the elevator whom you don't recognize. You don't even know them. What's your most appropriate immediate action? Join the conversation to provide professional input. Say nothing now and report your colleague to HR later. Politely interrupt, suggest discussing this in a private area. Ask the other people to leave the elevator. If I was there, I'm going to say this one, say, I'm going to report you, man. I'm going to make sure you're going to lose your job. And I'm going to make sure you lose your license. Are you or someone like that? Okay, well, everything looks so good to sell it, right? I mean, I hope you don't do this one, as you already know that doing that is wrong. But you have other options which sounds emotionally good. What is legally right? Okay, so you take a pause, you think about it. Right answer is to politely interrupt, not interpret, interrupt and suggest discussing this in a private area. So let's really see, and here is why HIPAA violation must be addressed immediately when possible. Okay, immediate address. This is important. I want you to remember this every day in your clinics, even every day in your hospital, every day where you're working. HIPAA violation need to be addressed immediately, right there. You don't wait, you don't ignore it, you don't report it without first giving your colleague the opportunity to correct their behavior. Everyone deserves chances, second chances. You give them, you tell them. I don't think that's right to discuss here. We don't want that here. You say something, hey, let's continue this conversation when we get to the office. That's it, professional, direct, and immediate. That's what you should be doing, okay? Why other options are wrong? Option A is wrong. You're participating in the violation, you're being involving in that violation. Option B is wrong. You're allowing violation to continue when you could stop it, right? You're reporting to HR later, but you're not interpreting it, stopping it, right? You're letting it continue and then you go to do HR. So what's the point, right? Option B is wrong and option D is wrong. The people those have every right to in the elevator. The other people are not want to leave because you have to say something. So obligated for that, right? No. So they have the right to be on the elevator. So that's not the right option. Okay. So now something similar to that, but a different scenario. This is a huge one. That's usually, something you should really know. A patient's adult daughter calls and asks for an update on her mother's progress in therapy. The mother is 76-year-old, cognitively intact, has not signed a release of information. What would you do? Patient's adult daughter is calling. I mean, that's her daughter. You mean if she asks something, you can say that. I mean, unless you have informed consent. I don't know if you do that, right? So option A, provide the update since the daughter is immediate family. Refuse to confirm or deny the patient receiving the service. Provide general information but not specific. Ask the doctor to speak with the physician instead. Whoa, this is the. I mean, that's immediate daughter. You should just give out the information if that's what you think. I don't know, man. You can't clear the NPT like thinking, right? Guessing. Refuse to confirm or deny the patient receiving the service. I don't know. Provide the general information but no specific. Should you do that? Ask the doctor to speak with the physician, not with me. What is going to be the answer? The moment of B. Okay, so why is that B? Refuse to confirm or deny the patient is receiving the service. Why is that? Because without consent, you cannot confirm or deny that someone is a patient. I mean, this sounds so harsh when I read this first time. What? Like my son or my daughter or my immediate family member don't have the right to know. Yeah, unless I don't sign the consent, they don't have the right to know. I'm an individual, man. I'm an adult, right? Without consent, you cannot confirm or deny that someone is a patient. Even saying I can give you that information imply that person is your patient. So you cannot say that too. The correct response will be I am unable to confirm or deny whether any individual is receiving services here without appropriate authorization. If your mother is a patient, she would need to sign a release of information from form before I can discuss her case care with you. Okay, so there need to be an informed consent from the patient to even disclose that you have this patient, that you are treating this patient. I mean, is it frustrating for the family members? Yes, but that's a law. No one is above the law, right? Option A is wrong because family starter doesn't override the HIPAA. That's a HIPAA violation. Option C, any information is a violation without confirmation, without consent. Any information, if it's small or big or general or specific, every information is wrong without the consent. Option D is wrong. Physician can share without consent either. Okay, whether it is physician or I don't want to say God. God is like, I don't want to say that. But whoever it is, without consent, you can share patient's information, health, PHI, okay? Protected health information you cannot share. Now let's show you sneaky HIPAA violation that students usually miss. So this is a social media HIPAA violation. This can usually come up very often in a daily basis. So you're updating your social media, you post, great day at work, just helped a patient to walk for the first time after their stroke. This is while IPT, no names or photos included. Is this a HIPAA violation? No. Think about that. You don't have any name of the patient, you don't have a photo, but you just say, great day at work, chilling at work. I just helped a patient to work. No, because no identifying information was shared. No, because it's a personal social media account. Yes, because details could potentially identify the patient. Yes, but only if someone recognizes who you are talking about. The right answer is C. Now, why is C? A lot of people do this actually, and they don't even know they are violating the HIPAA. Think about that. You're telling other stuff here, right? Patient have stroke, patient can walk now. So the students get tripped up. They think that I didn't say a name, I didn't post a photo. How is this violation? Because here is if there is a reasonable possibility someone could identify the patient based on the information shared, it is a violation because you're already telling the patient was not walking, patient had stroke, now is able to walk. So you're giving up some information there without consent. So that's the violation of HIPAA. Think about it. If you work in a small town, if you could only had a stroke patient, one stroke patient that week, if someone knows your schedule, they could figure out who you're talking about. The rule is simple. Never post about patient on social media. Never. Even without names, even in celebration. Never do it. Why the other options are wrong? Option A is wrong. You indirect identifiers still count, right? Option B is wrong because HIPAA applies regardless of the platform. It doesn't matter if it's your personal account, public account, whatever it is. Option D is wrong. This violate exists even if no one actually identifies them. Okay. So HIPAA, you need to have patient consent before you sharing anything, even with your immediate family members. Don't even think about sharing to the public and world. Okay. Don't talk that in public. You need to, before you report to other people, you first need to what? You need to stop that right there and then and there. Okay. My throat is started to hurt because we are entering into almost 1 hour at any cost and not make decision not based on emotion but on logic. Okay, all right, so that's HIPAA. Let's move on to mandatory reporting now. Okay, so we are going into the mandatory reporting part, but before that I'm going to take a break and we're going to, so what all we did right now, so we did this one, patient right and autonomy, documentation standards, we did confidential and HIPAA. Now we're going to do the mandatory report obligations. I hope you got the idea here, right? So let's continue on the topic. I'm gonna take a break and we'll come back later. Okay, so now we are entering the mandatory reporting obligations. So I want to start by the story so you get that idea of what is the mandatory reporting obligation. By this time we know we need to document everything so that way we are protecting both the patient and you, right? So this is one of the most important category of this entire exam, and it's one where students often let their emotions override their legal obligation. So here is the core principle. Certain situations require immediate reporting by the law, You don't need proof, you don't need permission, you don't need investigation, you need to report. Okay. So this is a very important thing in this all program of ethics and professional responsibility. You need to make sure your logic is overriding your emotions, right? Your understanding of the law need to override the emotion. So let me tell you a story that happened early in my career. I was treating a 9-year-old girl for shoulder injury. During the treatment, she was quite, withdrawn. At one point, she winced when I touched her upper arm, even though that was in the injured area. I asked, "Does this hurt?" She said, "My dad grabbed me there when he was mad." In that moment, I had a choice. I could rationalize maybe he just grabbed her arm to get her attention. Maybe she's just exaggerating, or maybe I'm overreacting, right? Or I could follow the law and say I reported it to a child protective service that day. So, was I 100% sure there was an abuse? No, but I didn't need to be. The law says reasonable suspicion is enough. Mandatory reports are legally required to report, and they are protected from liability when reporting in good faith. So let's look into an NPT question, example questions. This is very important. Okay, if you feel that your patient is going through abuse, whether it is it's a child or old age, the geriatric population, if you feel like they've been going through any kind of abuse, you need to make sure you report it. Then you don't want a lot of evidence. Under suspicion, if you feel a suspicion, you need to report it. So you're treating a 5-year-old child for development delays. You notice multiple bruises on child's arms and legs in various stages of healing. The parent explained that the child is very clumsy and falls a lot. What is your most appropriate action? So you can either document the bruise and monitor for future visit, report to child protective service immediately, ask the child privately if anyone is hurting them, discuss your concern with the parent before reporting. So based on this principle, it's a mandatory reports are legally required to report. What do you think will be the answer for this one? Right. So if you feel that a 5-year-old girl, a 5-year-old child for development delays has multiple bruises, and their parents are saying very clumsy, they're going to fall, there's a chances that happens, right? So what are you going to do? I mean, all of this answer look okay. But what will you going to choose? And report to child protective service immediately. Seems like a good option, but you can discuss with the parents further, right? Do you like did he really fell down and got the bruise, or something else is going on here? Or you can document it and wait for future visit. That can also be there. And you can ask directly to the child, is something really going on there in your house that we should be knowing, right? What do you think will be the answer? The answer is B. So this is mandatory reporting. If under suspicion, you need to always report. So multiple bruises in various stages of healing is a red flag for abuse. Okay, so here this says you notice multiple bruises on child's arms and legs in various stages of healing. If it was just one fall and you had a issue, it can be multiple bruises or different. Then the child need to fall down every single day, right? So you need it is a tricky question, but if you really focus on the details, you can get it right. So multiple bruises in various stages of healing is a red flag for abuse. The explanation of clumsy is a common cover story. You don't need to investigate, you don't need to confront the patient, confront the parent, sorry, you don't need the child to disclose. You are mandatory to report under suspicion of any kind of abuse. Okay, A is wrong because monitoring delays protecting a child who may in danger. She's already might going through some kind of trauma or physical abuse, right? So you again delaying it with the documentation. So that's not the way. Option C is you're not trained to interview the child about abuse, and it could compromise investigation. So you're not made for all the interview with the child to get to know what is going on. Option D, you don't need parental permission, and confronting an abuser can escalate the danger. So That's a big no. So it's the mandatory reporting obligation means if you feel there's an abuse going on, you need to report it to the if the child protective services and the needed advisory board about things that are going on. I'm required to, so here what is going to say to the parent, I'm required by the law to report any injury that could potentially indicate abuse or neglect. This is standard protocol. Child protective service will conduct an investigation and they will be in touch with you. You remain professional, you don't accuse, but you report. Right, now let me show you a different type of mandatory report. So that was the child abuse that you report to the child protective services. That's a mandatory report under suspicion. You don't want a lot of evidence, you under suspicions, you can do it. Now another one is elder neglect. This is huge. You're treating 82-year-old patient with the dementia, a skilled nursing facility. The patient has lost 50 pounds in past month and appeared to dehydrated and has multiple pressure ulcers. The staff attribute this to patients not eating well. What should you do? Because you feel like the patient is losing the weights and he's dehydrated and not eating well. So what you going to do? Document your finding, inform the director of nursing, report suspected neglect to adult protective service, increase your frequency of visit to monitor the situation. I mean, you already saw the answer. It's pretty obvious. Report the suspected. So in these cases, you don't need a lot of evidence. You don't have to prove it or what. You are not someone who should be investigating. Okay, if you feel that you're instant telling this person is going through abuse, any kind of neglect, you need to report it to the appropriate board, right? So report the suspected neglect to adult protective service. So B is the right answer. This is suspected elder neglect or abuse require immediate reporting. Why? Because the patient is vulnerable adult. Significant weight loss, dehydration, and multiple pressure ulcers indicate failure to provide adequate care. This is a neglect. Yes. You can also inform the facility director of nursing, but you are legally obligated to report to adult protective service. You can also do that, but again, you are thinking about the most appropriate action. Okay, so mandatory documentation is needed in these neglect issues. Monitoring is not substitute for reporting. You need to report regardless of whatever you're monitoring, whatever you're going to use. No, you need to report it. Option D is wrong. Education doesn't address the immediate safety concern. So the core principle is if you are a vulnerable population is at risk, children, elderly, or individual with a disability, your duty is to protect. The duty is to report first and support second. So first thing you gotta do is report. The mandatory report. They have children, right? You have neglected population, like who are in vulnerable. We call this vulnerable population: children, disabled individuals, and elderly. Okay, if these people don't have the ability to make their own decision and they are vulnerable in some part of their life, so you need to have extra precaution in these cases, and if you feel there's any abuse is going on, you need to mandatorily report it to the necessary people. Okay, now let me give you a scenario that combine mandatory reporting of the scope of the practice. Another mandatory reporting case is suicide risk. Okay, so during a treatment session, a 60-year-old patient confides that they have been suicidal thoughts and has a plan. They beg you not to tell anyone, saying you are the only person I can trust. What is your most appropriate action? So if patient tell you, I'm going through a really bad time, I don't think I don't want to live anymore, I want to, I have the suicide thoughts going on, and I trust you, don't tell this anyone. Are you going to tell someone else that? Now you need to think this is an very emotional place to be, right? But when it comes to this exam, I don't want you to make any decision based on emotion. You need to make as per the laws and regulations set by the appropriate board. So the first one is you can honor the confidentiality to maintain the therapeutic relationship. You can immediately notify the parent or guardian and the document. Stay with the patient, ensure safety, and activate appropriate mental health emergency. Or D, you can encourage them to speak with the school counselor. Okay, so are you going to notify the parent or guardian and document it? So if you're telling the parent, guardian, and then documenting it, or you're not telling at all, or you have the options to stay with the patient, ensure safety, and activate appropriate mental health emergency, or encourage them to speak with the school counselor and send them home, which is not a good idea. So the right answer is here is stay with the patient, you're ensuring safety, and activate appropriate mental health emergency protocol. You know why? See, I told you the highest is safety of the patient. You need to be with them when someone says that I don't think I'm having good, I think I need to kill myself, right? So that's a very, very imminent threat there. So you need to make sure you provide that safe. This is an imminent safety threat and you must act immediately. There is no reporting going on, you can wait and then do something. So thank you for trusting me. What you're going to say is thank you for trusting me with this. I need you to know that when someone tells me they're thinking about hurting themselves, I can keep that private because your safety is the most important thing. I'm going to make sure you get help right now, and I'm going to stay with you until we get you connected with someone who specializes in this. You're not in trouble, we're going to help you. Okay, so first you stay with the patient, ensure the safety of that patient, and then you activate appropriate mental health emergency protocol because they have better skill on dealing with these cases. Okay, then you don't leave them alone. Okay, don't go for something else when they tell that. You're going to contact emergency services crisis intervention based on the setting, notify the guardian if there is a minor, and then document thoroughly. Okay, so first is always the priority is always for the safety of the patient. So option A is wrong because confidentiality does not apply when there's an imminent danger. So you might think that HIPAA violation patient, you cannot without consent, you cannot tell these cases to another person. So this confidentiality can become a gray area when patient's life is under threat. So safety comes the highest priority. Everything else disappears when that comes. So someone tells about the suicide kind of things, you need to make sure you are making sure they are safe, and then you take help from the people you really need. Okay, option B is incomplete. You need immediate intervention, not just notification. Okay, notify, but you didn't stay with the patient, or you didn't do intervention to make sure it's not happening. So that's not the right answer. And D, this is beyond the school counselor immediate scope. It's a mental health emergency. So school counselor is not the right person to do that for this kind of emergency. Okay, so that's beyond this scope of practice. So you need to go for someone who know how to deal with this mental health issues. Okay, so the core principle is when someone is in imminent danger to themselves or others, confidentiality is a suspended by duty to protect. I don't know if I said right, but you know what I mean. Okay, so safety is always the highest priority. Everything else goes below that. So we got one more mandatory reporting scenario. This is a huge, and you're probably going to see this in your career a lot. Okay, this is called healthcare fraud, happening huge. Okay, and I want you to, if you feel that somewhere healthcare fraud is happening, you need to report it. Okay, mandatory report that. Don't let these people, So fraud reporting. You notice that your supervising PT is consistently billing for 60-minute session when actual treatment is 30 to 40 minutes. When you raise your concern, they tell you this is how we stay profitable. Everyone does it. What should you do? I mean, this might be happening in a lot of places. So when you are delivering only 30 to 40 minutes of care and PT is billing 60-minute sessions, you need to understand that that's a fraud, billing fraud. Okay, continue as directed since you're under their supervision. Document your concern and report to compliance office, or appropriate authority, resign from the position to avoid involvement. Or you can do what? I mean, you already saw the answer, but I think you already guessed it. Document your concern, report complaints to other appropriate body. You know, you need to report these things. You gotta report this. There's no other way. Okay, you can resign after reporting. You probably resign from these places because you know you don't want to work in a, I call it PT mills, right? Continuous directed since you are under the supervision. Discuss with other staff to see if they are concerned. I don't know. That's the right answer. So billing more than what you provided is a healthcare fraud. You're legally obligated to report it. Why? Because billing for service not rendered is fraud. It violate not rendered is fraud. It violates state and federal laws. It can result in criminal charges, and if you participate even by staying silent, you can also be held liable. Okay, so this is a very bad things that happening, and if you see that's happening in your clinics or in your settings that you're working, you need to report it to the appropriate body, so and held them accountable for the fraud they are doing. Okay, here is hard truth: witnessing illegal behavior and not reporting can make you complicit. Close your eyes when you see that. No, so if you see that this fraud is happening, you need to report it. So you document what you observed, you report your facility compliance officer, or if there isn't one, to the state board or office of inspector general. Okay, yeah, I know this is uncomfortable because you'll be working for them and then you're complaining about them. This might affect your job, but your license and your integrity are worth more than any job. Okay, so protecting your license is the most important thing for this. So that's why I say ethics and professional responsibility is a high return on investment, because if you know this, you're going to protect your license. Okay, so option A is wrong, which is just following orders is not legal defense of fraud. So you're under the supervision is doing something wrong and asking you to do something wrong, and you're doing it. That means not you're not in a place to reporting it, and you're just following orders. So that's not the right thing to do. Resigning without reporting allow the fraud to continue. If you resign that place without reporting that fraud, you basically what letting that fraud continue, and that's not the right thing to do. This is a democratic decision. It's a legal obligation. So if you see that you're discussing with the staff and making a decision, no, the rules are set. The rules are already known. There's no one nothing above the law. So there's no democratic need of, do you think that is right? How right is this out of a scale of 1 to 10? No, I don't want to do that. Right? So you have an obligation to report illegal, unethical, or unprofessional behavior even when it is uncomfortable. A lot of time in life, you need to know that there's a lot of decisions you need to make in life will be uncomfortable, but you need to make it, right? Unprofessional, unethical, and illegal behaviors need to be reported. All right. So that's mandatory report. Let's talk about the scope of practice, and now we are entering the team roles. So this is called the scope of practice and team roles. So one of the most common mistakes we make on the NPT is not understanding difference between PT roles and PTA roles. PTA roles, okay? Other healthcare profession and other healthcare. So the roles, everyone has their own roles. And you need to know that, because this is a huge part students lose their marks, lose their points, because no, they don't really know that what should be a PTA should be doing, what should be a PT should be doing, and what other professionals should be doing. Okay, so even there's PT students, aides, right, PT techs. So you need to know each one of the rules. And a lot of the clinics are asking PTA to do PT's job. PTs are just documenting, and sometimes aid is doing the PT's job. There's a lot of mess. So if you see these things, you need to make sure you intervene and make these things, report to the legal bodies also. Okay, so for that, if you need to know what's going wrong, you need to know what is right. So here is the core principle. Each healthcare professional has defined scope of practice. Staying within your scope, protect patients and protect your license. You need to make sure you are within your scope of practice and you're not going about that. So sometimes you feel like you want to be a superhero, but don't be a superhero, you'll end up losing your license. So you need to make sure this is my ability, this is my decision making skill, I need to stay within that. So that will help you a lot. So let me give you a real world example. Okay, this is a something I want you to take note. So medication advice. Your patient asks if they should stop taking their blood pressure medication because they have read it can cause fatigue. What is your most appropriate response? So the patient is asking you, I mean, you are a medical paramedical professional and they're expecting you to tell something about medications. What are you going to do? You know pharmacology, you know these things, right? So advise them to continue medications prescribed, suggest they try to stop it for a week to see if energy improves, explain that they cannot advise on medication and refer them to prescribing physician, research the medication side effect and provide information. What is the right thing to do? So the right thing to do here will be explaining that you cannot advise on medication, refer them to prescribing physician. Why? Because medication management is government PT scope. You are not supposed to give any kind of advice on medication. Okay, so it's better to prescribe them to the physician and ask them to talk with the physician and think about their opinion. Okay, can you provide general education how medication might affect exercise tolerance? You can tell them to stop or continue medication or not. So if patient asks you, I'm taking this medication, how is going to affect me? You can give a general advice, but you cannot tell that you need to take this medication. Okay. So you cannot tell them to stop a medication or continue a medication. This is out of the scope of your practice. So don't be a Superman. I want to be, well, what is the song? Wanna be a Superman. Wanna be a Superman or superhero. I don't know. But you cannot be a Superman here, man. You need to know that you are in this box and you cannot play outside that box. So to protect your license, right? So so what are you gonna say? I can advise you on whether to stop your medication. That's something only your prescribing physician and can address. What I can tell you is that some blood pressure medication can affect exercise tolerance and energy levels. If you are experiencing concerning side effects, it's really important that you discuss that with your doctor. Would you like me to send them a note about what you are experiencing? Okay, so that is the best way to put it. You are looking to the physician and they have the authority to prescribe the medication. They should be doing it. That's beyond the scope of your practice. So you're practicing outside the scope of your, if you're advised medication. B, you're giving medical advice that could be dangerous. So you're trying to tell them to stop someone who has a blood pressure. What if they get high blood pressure and get a stroke, and then things can get really bad? Option D is wrong. Providing information about side effect in the context of advising about continuation is still overstepping your boundaries. Okay, so you need to know what's your boundaries, what your limitations, and what is your role and your scope of practice. So let me show you another scope of practice involving PTAs. So you're a PTA supervising a PTA. Which of the following tasks would be inappropriate to delegate to PTA? So as a PT, there's a PT assistant that is there to help you. What do you think will be an inappropriate action to delegate? Okay, implementing a gait training program you established, modifying a patient exercise program based on patient response, completing an initial examination evaluate for new patient, documenting progress toward goals you're established. Okay, this is a really important concept because everything look a good answer to me. Implementing gait training program that you established. Think about it, you established, they're just following it, right? Modifying a patient's exercise program based on patient response. This one is, I don't know. I mean, modifying doesn't seem so good because they are modifying the program. Completing an initial examination evaluation for the new patient. You think a PTA can do an initial evaluation? No. Documenting progress toward goal you have established. So that's the progress notes, right? This is, I mean, if you really know the PTA roles, you can directly go to the answer, but you need to know it. So you cannot modify it, you cannot do an initial assessment, you cannot do a progress note. So you are actually going against all of this. So the question here is, you need to see that inappropriate to delegate to PTA. Okay, so what will be the thing is inappropriate to delegate. It's not what question is a little tricky too, right? So you're telling not appropriate, what is not right. So if you see that completing an initial evaluation for a new patient is out of scope of practice of the PTA. Okay, so PTAs cannot perform initial evaluations, re-evaluation, established plan of life. Those are PT only responsibility. So what is PTAs are for there? If you have a plan as a PT, PTA can follow that, right? You can establish the implement established treatment plans, right? They can carry on the already established plan by the PTs. You can make adjustment with established parameters. There can be some changes you can make, maybe increase the weight, maybe increase resistance, right? You can document the progress, but you need to know, make sure there is no reevaluation done by PTs. Okay, that is done by PTs only. But you can document the progress that made over the time, and you can provide the patient education, the PTS can provide. So initial evaluation, re-evaluations, and making plan of care is all done by PTS. That is cannot be done by PTS at any point, right? When you read the question, I want you to make sure you are looking into the details of it. Here is inappropriate to delegate. Okay, so that need to be look into it. So that is the role of PT and PTS. Now, PTA cannot perform initial evaluation, PTA cannot perform re-eval, cannot establish diagnosis or prognosis, okay, and determine discharge. That should be done by PTs. This is critical for exam because they will test whether you understand appropriate delegation. Okay, so delegating what should be done is a very important thing. You cannot give everything to PTs and only do documentation. All of PTs do that. That's also a fraud and inappropriate way to do this, deal with the things. Okay, so as you start get the license and start practicing, you will see a lot of things, and I want you to remember these things we're discussing in the class and making sure that you are protecting your license. Okay, uncomfortable decisions to make, but you gotta make it. Now let's talk about interprofessional collaboration. So in the world of medical field, there's transdisciplinary approach, right? Multiple disciplines, multiple professionals are coming together. There's an interprofessional collaboration for the better patient care. So a patient with the COPD has developed productive cough with the green sputum during treatment session. You suspect respiratory infection. What is the most appropriate action? If you feel that this patient has developing a respiratory infection or pneumonia or any kind of stuff, the patient has COPD and sputum is now green, that means it is infected, right? Green sputum. Remember this one, we will going to talk this in cardiopulmonary, but green sputum during treatment session, you suspect respiratory infection. What is the most appropriate action? Okay, continue treatment, document finding for the next physician visit. Contact the patient's physician to report your clinical finding. Prescribe around or count cuffs are present. Oh hell no. Perform a full respiratory examination to confirm the infection. Okay, this is, you need to know what is the most appropriate action you're going to do. You need to understand, if you find an infection case and you think that this is, first of all, respiratory infection is something beyond your control. Okay, in the respiratory care, your concern is clearance. Okay, sputum clearance will be your concern, but infection things is beyond your scope, and you probably need to communicate it with someone who know how to deal with it. So what are you going to do? Are you going to prescribe a drug there? I don't think you should doing that, right? Perform a full respiratory examination, confirm infection. I don't know. What do you think? Contact the patient physician to report your clinical findings. Continue treatment and document the findings for next physician visit. So most of you be thinking between these two. Should I report to clinical findings now, contact the patient physician now, or I just document it waiting for the next physician visit. What do you think will be the right answer? You come into the two answer trap. So the right answer is B. When you observe signs that fall within another professional scope, your role is observe, document, and communicate, not diagnose or treat. Okay. So when you see that there's something beyond your scope of practice, it's very important that you need to refer them, or you are communicating it with the other profession. So when you observe signs that fall within another professional scope, your role is to observe it, document it, and communicate it, not diagnose or treat it. Okay. So I know we all want to be a Superman, but don't be a Superman to lose your license. It doesn't worth it. So you need to know that if this is within my scope of practice, if not, you observe it, you document it, and you communicate it to, no diagnose or treat. Okay, you recognize a change in the clinical status that's within your scope, but diagnosing it and treating respiratory infection, that's physician's scope, because you're not going to do anything with this infection. Only thing you can do is airway clearance, but not treating the infection. So you need to know that is not within your scope of practice. So you need to document it and communicate it with your physician. So I'm treating Mr. Smith for pulmonary rehab. You're telling the physician, you call the physician, I'm treating Mr. Smith for pulmonary rehab. During today's session, he developed a productive cough with a green sputum report and reports feeling more fatigued than usual. I wanted to make you aware in case this needs medical evaluation. So that's an interdisciplinary communication. Okay. So waiting delay needed care. Okay. So care something needed immediately, or waiting for next visit and all, that's not a good idea. Prescribing medication is, that's not your scope. You should be a physician for that. I mean, if you wanted to, you can be a physician. 7 years after, don't. So some people, they regret being a PT. I don't know why, man. If you want to be a physician, go be a physician. Why you want to be a PT? If you want to prescribe medication. Okay. I just hate these people. I mean, okay, option D wrong. Option D is wrong because you're not diagnosing a medical condition. You're not here to diagnose or treat these things out of your professional scope. Okay. So the core principle is know your role, respect others' role, and communicate effectively across discipline. You need to know what is your. Some people don't even know their role, and they need to take others' role, and then don't communicate effectively also. So first you need to know what is your role, then only you know how to play within that role. If you know your role, then you won't get into others' role, right? So respect others' role and communicate effectively. Okay, communication is huge in this part of the game, and without that you ain't getting nowhere. So one final scenario about professional boundaries is last one question. Okay, we are 18, scenario 18, we have 28, right? Okay, so a patient you have been treating for several weeks invite you to their daughter's wedding. They say or become like a family to them. What is the most appropriate response? This happens a lot. Okay, so this is very important because therapeutic relationship is very huge, because you've been getting to know this patient, you're very comfortable, right? They think they start feels like see you like a family member, man. That's a big thing, but you have to know the boundaries. Certain things you cannot cross, and keep the professionalism is very important. So a patient you have been treating for several weeks invites you to their daughter's wedding. They say you have become like a family to them. What is the most appropriate response? So you can either accept the invitation since you developed a strong therapeutic relationship, politely decline and explain the importance of maintaining professional boundaries. Attend the wedding but avoid socializing to maintain professionalism. Accept but discuss with your supervisor first. That's like the every answer look. Oh man, every answer looks so right. What are you gonna do, man? I mean, politely decline and explain. This is okay, bro, but I don't think I want to come to the wedding. So the most appropriate thing to do is maintaining professional boundaries is essential to ethical practice. So this is huge. You need to make sure that we can be really good with the patient, the therapeutic relationship is good, but there are certain things you cannot cross the boundaries. Then that become a gray area. Okay, so these are the things you need to know, that if you cross these boundaries, you need to keep this thing in my back of your mind. You may lose your license, 7 years of education, 100K tuition fees, passing this exam, and all this hard work, all this time, all dedication, man. Maybe go like that. So we don't want to do that. I'm so honored that you think to invite me, and it's wonderful to hear that we have developed such a positive relationship. However, as your therapist, I need to maintain professional boundaries. It helps me to stay objective in your care and ensure relationship stays focused on your health goals. But I'm thrilled to hear about your daughter's wedding, and I hope it's a beautiful day. Because once you get the relationship, therapeutic relationship, get closer and closer, and your objective decision making can become vague because of that emotional overall. So staying away from these kind of things and knowing where is the boundaries and keeping that professional boundaries essential. Setting blur professional boundaries, so, right? So the once you become too close, that blurs the professional boundary. Attending at all crosses the line. Supervisor permission doesn't change the ethical issue. So ethically, it is not the right thing to do. So core principle: therapeutic relationship have boundaries that protect both the patient and the professional. Okay, so you need to know what's your boundaries, and you don't want to break that in patient, and making sure that you are a professional, right? So that's the scope of the practice. Now we're going to get into something related to money. This is billing and coding practices. These are what we covering is highest return on investment you're going to make in the exam and in your life. So ethics, professional responsibility, huge. Yeah? Now we are entering the billing and coding and fraud. This is a huge part. So we completed let's see how many things we completed till now. Okay, so we completed the mandatory reporting, we completed the scope of practice. Now we are going into the billing and coding and fraud. Okay, so now we're going to talk about something that makes a lot of students uncomfortable: money, specifically billing practices. Okay, here is the reality. Healthcare is a business. It's a money-making business. You provide service, and those services are billed to the patient and the insurance companies. But there are strict laws about how billing must be conducted. And here's what NPT wants you to know. Do you understand the difference between accurate billing and fraud? Let me give you a scenario. This is scenario 19. We are getting closer to ending this thing. Okay, so there's an 8-minute rule and accurate billing. This is a huge one. Okay, you provide a 30 minute of manual therapy and 50 minute of therapeutic exercise. Your billing software automatically called for 1 unit of each of the following the 8-minute rule. Your clinic manager asks you to code for additional unit of therapeutic exercise to maximize reimbursement. Which should you do it? So you provide 30 minutes of manual therapy and 50 minutes of therapeutic exercise. So your billings are automatically called 1 unit of each following the 8-minute rule. Okay, so they gave 1 minute 1 unit for each of this. The EMR automatically gave it, but your clinic may ask you to code for an additional unit for therapeutic exercise. Okay, so to maximize reimbursement, this is usually happening. So what are you gonna do? So would you gonna follow what your clinical manager told you? Because might lose your job, Follow the manager's directive since they are responsible for billing. Code for only one only the time you actually provide the document accurately. Code for additional unit but not the discrepancy in your documentation. Split your time differently across modalities to justify additional billing. You already know the answer, man. You cannot do this kind of fraud and make money. And so the answer is B. This is critical. Billing for service not rendered is fraud. Full stop, mic drop. You cannot bill for the things you're not done. Okay, you can only bill for the things you provide. So code only for time actually provided and documented accurately. So under this is a huge and a very important thing I want you to understand. There is something called 8-minute rule. Okay, so under 8-minute rule, 8 to 22 minutes will be 1 unit, 23 to 37 minutes will be 2 unit, and 38 to 52 minutes will be 3 unit. So here if you see that you provided 50 minutes of therapeutic exercise, so that will be 1 unit. So this is the rule I want you to by heart. This is something you need to know. So there's an 8-minute rule. The 8 to 22 minute, it's 1. From 23 to 37, 2 unit. 38 to 52 minute is 3 unit. And this 22 minute can be the total also. So if you see that 50 plus 30, right, that will be 45. So the 45 will come within this one, 38 to 50. That will be maximum 3 unit. You cannot bill more than that. So if they ask here, so the software automatically 1 unit of each. So your billing software automatically called for 1 unit for each. So you provided 30 minutes of so manual therapy you can give 2 units, right? And for therapeutic assist you can give 1 unit. So that will be a total of 3 units. But here the clinical manager asking him to give 2 units for the therapeutic exercise, which you should not do, because 50 minutes is 1 unit. Okay, so this is a rule you need to understand. So 8 to 22 minutes is 1 unit, 23 to 37 is 2 unit, 38 to 52 is 3 units. Now if you are providing 50 minutes of therapeutic exercise, it will be 1 unit. If what happens if you provide 30 minutes of manual therapy, how much units you going to give for that case? It will be 2 units, because see 23 to 37 is 2 units. So the total in this one you can bill is 30 plus 15, 45 will be 3 units. Okay, so you provided 50 minutes of therapeutic exercise, that's 1 unit. Billing for 2 unit is fraud. Here is the important part. You're responsible for the accuracy of your documentation billing even if someone else submit it. So some billing companies might be submitting it, but it is your responsibility that you're billing it the right way and documenting it the right way. So option A is wrong. I was just following the orders is not a legal defense. This is a fraud. So you ask, if you ever ask to bill fraudulently, you document your refusal. If necessary, you report to the compliance officer. This is a huge, maybe when you go to different places, he may ask you to do this, but don't do it. Knowingly billing inaccurately is fraud. Option D. This is called creative documentation, and it is also fraud. So you document in a way that you want to push these units. That's called creative documentation, which is also a fraud. So upcoding for the coverage is another thing. Okay, so what is that? A patient insurance has denied coverage for additional PT visit. The patient cannot afford to pay out of pocket. So your clinical supervisor charges billing under a different diagnosis code that would be covered. What you should do? Okay, this is another billing thing. Okay, so this is all, play around the loop, it's saying. So when you bill, patient came with a hip pain and the insurance has been run out under that case. Now you are going under different diagnosis code and then billing it again. Okay, so a patient's insurance has delayed coverage for additional PT visit. The patient cannot afford to pay out of pocket. Your clinical supervisor is billing under a different diagnosis code that would be covered. What should you do? So use the suggested code since it help the patient to continue to need the care. Refuse and explain this constitute fraudulent billing. Use the code but document actual diagnosis in your DOS. In your notes, offer to treat the patient for free to avoid billing issue. Oh man, so this is usually things that happens in the clinic, I want you to know that this is all fraud. Refuse and explain the constituent fraudulent billing. Okay, so upcoding or miscoding to obtain reimbursement is also an insurance fraud. You cannot tell something else and put that code, give a different diagnosis code to get that insurance coverage is also a fraud. I know this feel heartless, right? The patient needs care, but they can afford it. You want to help, but here is the reality: using incorrect diagnosis code to obtain coverage is illegal. It can result in criminal charges, loss of license, and civil penalty. So you need to really know you can do these things out of even emotions. I mean, this is really bad. What can you do? You can discuss the payment plans. You probably think about self-pay or explore other financial assistance programs or provide a home exercise program, refer to community resources. Okay, but you cannot commit to the fraud to help the patient. Even to help the patient, you cannot do that. Why other options are wrong? Option A is good intention. You don't justify fraud. You have good intention. You think that's a good thing, but that's a fraud. The billing record and clinical record must match. Okay, so you build for one diagnosis and the clinical record is different. That can lead to a fraud. So there's a mismatch between these two. Option D might be an option if your facility allows pro bono care, but it doesn't address the fraudulent coding suggestions. That can be also a issue there. So billing under appropriate credentials. A PTA treat a patient for 45 minutes and you are evaluating another patient in the same clinic. The PTA asks if they can bill under your NPI since you're available if needed. What do you tell them? See, these are the things I'm telling you. This is not just an exam thing, bro. It's gonna happen on a daily basis in your clinics, in the hospital. But a lot of the mill clinics are doing this. So if you find this, report them. Okay. A PTA treat a patient for 45 minutes. You're evaluating another patient in the same clinic. The PTA asks if they can bill under your NPI since you're available if needed. So allow it since you're physically present in the clinic. Explain that service must be billed under the credential of the provider who performed them. Allow it to review and co-sign the document and allow it only if you check on the patient during the session. See, this is their PT is asking, can I bill under your NPI? And you need to know if they do it wrong, you will be held liable. Okay, so you cannot let that happen. So the right answer is explain the service must be billed under the credential of the provider who performed them. Okay, if you perform them, it's under you. If they perform them, it should be under. So the PTA treat the patient for 40 minutes while you're evaluating another patient in the same clinic. So it should be under PTA's NPI, not yours. So services must be billed under the credential of the individual who performed them with appropriate supervision is indicated. PTs bill for service under their own credential with the supervising PT identified. They don't bill under PT's NPA as if the PT performed the services. Why? Because misrepresentation. Who provide the care, that's also a fraud. So option A is wrong. Physical presence doesn't change who performed the services. Just because someone is physically present there doesn't matter who performed them. Co-signing doesn't make it your services. Okay, checking in doesn't mean you provided the care. So core principle, billing practices must accurately reflect the service provided and who provided them. You can only bill under your NPI if you are the one who provided. Someone else provided, should be under their provision. Okay, all right, so that's billing and coding. Now you're going into cultural competence. This is also another big thing: social economic factors and cultural competence. Okay, so this category that students often misunderestimate, but NPT increasingly includes questions about culturally responsive care and how social economic factors affect the patient management. Here is the core principle: effective patient care requires understanding and respecting the individual difference in culture, language, and socioeconomic status and health literacy. So let me give you a scenario. This is huge. So for me, when I came from India, that's a different cultural background. And when you come to US, like New York, That's a whole different cultural background. And the way people communicate, the way things they discuss, the small talks, all these things are different. So adapting to this culture, adapting to their uh, sense of humor, sense of emotions, and their topic of discussion, all you need an adapter. You need not just that, you need to adapt to these things to make sure things are culturally appropriate. Something that culturally appropriate in India might not be culturally appropriate here. Something here appropriate might not be there. So these things is a huge thing to know. Okay, not just for the exam, for your life and your professional life also. Okay, so you're treating a patient from a cultural or different, direct eye contact is considered disrespectful. You notice that patient consistently avoid eye contact during the session. What is the most appropriate response? Encourage the patient to make eye contact to build trust. Adapt your communication style to respect patient's cultural norms. Document the patient's uncooperative or withdrawn. Ask the patient why they don't look at you. So, I mean, anyone with the common sense know that you need to respect their cultural norm and you go to their space. Okay, so cultural competence means adapting your approach to meet the patient's need, not forcing them to adapt to you. So you are there to give the best experience for the patient, so you are trying to adapt to their, see how you need to reach to their level and then treat them. Okay, you don't need to interpret lack of eye contact as disrespect or non-engagement. You recognize it as a cultural difference and you adapt to it. How? You focus on other communication good body languages, verbal response, engagement with activities. You don't demand behaviors that violate the cultural values. Okay, why other options are wrong? Option A, you're imposing your cultural norms, the cultural bias, not clinical observation. Okay, C, because you're documenting uncooperative or withdrawn, it's not a clinical observation to make. This could be patient, option D is wrong, because this could be make the patient uncomfortable and implies they are doing something wrong, because that's part of the cultural norm. That's how they are grown, right? Who are you to go say, wait, look at me in the eyes, look at me in the eyes and say it? Okay, now we are entering the health literacy and language barriers. This is huge also. You need to, so when you talk to a patient, you need to know what is the level of their education, what is about knowledge about their condition, and you need to get to their level and explain things the way they understand. A patient who doesn't speak English well nods and smiles when you explain the home exercise program, but the spouse later calls and says the patient doesn't understand what to do. What was the most appropriate action to take initially? Assume comprehension based on nodding and smiling. Use teach back method, how the patient demonstrate or explain back to you. Provide written instruction in English for them to translate later. Speak more slowly and loudly to ensure understanding. So this is huge. I mean, especially in US, when I came to here, there's people from different background, right? They talk different language. They might be in a different cultural background. So you need to know, are they really understanding what you are saying, or are they just being, yeah. So how will you navigate in this case? So the right answer is B. You need to use teach back method. This is a huge in the world of PD. Okay, so this test an important concept. Okay, nodding and smiling do not confirm understanding, especially across language barriers. So teach math method is a gold standard. This is what is a gold standard. If someone is there, how will you know if they understood? I want to make sure I explain this clearly. Can you show me how will you do this exercise at home? So when you do that, if they're showing you, then you know they really understood what you're telling. Can you tell me in your own words what you'll do? If they can demonstrate or explain it back accurately, they understood. If not, you clarify and try again. Teach math method is huge in patient communication. If you feel like they don't understand an exercise, you tell them, can you show me how we're going to do it? They show it, they understood. If not, they don't get anything, bro. You need to probably go and teach them all again. So option nodding can be a cultural politeness gesture, not a confirmation. Written instruction in a language they don't understand, they only don't know English, so your instruction in English, there's no use in it. Speaking louder doesn't help with the language wherein it can be perceived as condescending. I don't know what is that, but it's not right. Okay, so teach back method, you should read on it also. Teach back method is a huge way how you can teach this exercise to this patient. So core principle, always verify understanding, especially when a language or health literacy can be a barrier in any case. Okay, Socioeconomic barriers to care. A patient misses multiple therapy appointments. When they do attend, they mention they don't always know a way to get there. What is the most appropriate response? So a lot of people, all especially all people are very young people, right? Young patients don't have the access to a transportation service. So what are you going to do? So discharge the patient for non-compliance. Good job. You're not coming in my time. You should not coming, bro. I'm discharging you. Whoa. Explore the barriers and problem. Explore the barriers and problem solve solutions. Okay, you provide with the teleported assistant, telehealth, document non-compliance and inform the referring physician, require the patient to arrange transportation before scheduling future appointments. The most common sense will be the B. So non-adherence is often related to barriers, not lack of motivation. So non-compliance. Transportation is socio-economic barriers. It does not mean the patient doesn't care about their health. It means their lack of resources. So if patient has an issue with the lack of resources, you're thinking, can you provide these resources in any way? Does your facility offer transportation? Is telehealth an option? Can you provide a home program with less frequent in-person visit? Are there community resources you can connect them with? Okay, so you're going to look into these things and then you're making a decision. So option A is wrong. This punishes the patient for systemic barrier. You're discharging the patient saying that non-compliance. That's not non-compliance. He wanted to come, but guess what? He don't have a car. Labeling it non-compliance, ignore the real issue. You can. The real issue is he don't have a car, bro. He's compliant to what he want to do, but he cannot. Option is wrong. You're placing the burden entirely on the patient without exploring other solutions. So if there's a barrier, you address the barrier. Don't blame the patient for circumstances beyond their control. Okay, is another. Let's quickly cover the final three category: human resource, risk management, and technology. Okay, so we have 25, 26, 27, 28, 4 more questions and we are done with this. Woo-hoo, let's go. So human resource and workplace safety, sexual harassment is a huge. So a colleague make repeated comments about your physical appearance that make you uncomfortable. You ask them to stop, but they continue saying, I am just being friendly. What should you do? So someone is making, oh man, you look so... What are you going to do, man? As a physical appearance, you're making them uncomfortable. So ignore it to avoid workplace conflict. Report to HR as potential sexual harassment. Comfort them more forcefully. Ask the coworker if they think it's a problem. What you gonna do if you experience this in the workplace? I mean, some of you going to experience this. There's really bad people out there. What you gonna do? So report to HR and potential sexual harassment. It's the right answer. So unwelcome comments on sexual nature, even if it's a friendly, can constitute harassment, especially if they continue after you ask them to stop. Okay, so you already asked them to stop, but they're still continuing with intention of harassing you. So you need to report it to HR and as a sexual harassment, and they need to take an action. So you document the incident, report to HR. This isn't about overly sensitive. It is about maintaining a professional workplace is very important. Okay, so next one is OSHA and bloodborne pathogens. This is also a huge thing that you need, especially working in a skilled care facilities and hospitals. You need to be really cautious about this thing. Now, risk management and quality assurance. A patient falls during therapy despite appropriate safety measurement. The patient is not injured. What is the most appropriate action? So a patient falls during a therapy despite you did all the safety, you had the gate bell, but still patient fall. What are you going to do? Document the incident in patient chart only. Complete an incident report and document in patient's chart. Only complete an incident report to avoid litigation risk. Don't document since the patient was injured. You already know, man. You already know. You got to document it to protect you and the patient. So answer is all adverse events must be documented in a medical record and report through the facility incident reporting system. Why both medical record document happened clinically. The incident report is for quality improvement and risk management. Okay, so incident report, there's something called incident report. You need to do that, so that way you can make sure it won't happen again, and you need to document it in the clinical document that serves as a legal document also. So never skip document just because there was no injury. Near misses are learning opportunity. So incident reporting protect everyone and improve quality care. We are entering the last question here. Telehealth and quality standard. Okay, you're providing a telehealth to a patient. During the session your internet connection become unstable and the video freezes repeatedly. What should you do? So you're providing the telehealth and the video freezes repeatedly due to the connection problem. What you gonna do? So continue the session and document full time since you're available. End the session, troubleshoot, reschedule or switch it to phone. Continue with audio only and bill for the full session. Have the patient drive to your clinic in an in-person visit. But no, that's not the one. Continue the session and document the full time since you're available. That's also not the one. Continue with audio only. That means you're not providing the full service. So what you going to do? Right answer is B1. Telehealth service must meet the same quality standard as in-person care. Okay, if technology issues prevent adaptive assessment or treatment, you don't just push through your problem. You solve the problem and then you give them high quality care. Okay, so the telehealth service must meet the same quality standard as in-person. You cannot do the other way. So technology is a tool, not an excuse for substantial care. So you need to make sure the quality of care is maintained. So all right, so let's take a breath, man. So we've been doing this for, I mean, more than 1 hour now. So we covered core principle of professional responsibility, but you need to know the ethical principle of professional responsibility. This was a trailer call. This was just a tip of the iceberg. We're gonna discuss this more. Deep understanding and deep study is going to happen in the big three, in the system and non-system part of the big three module. Okay, so if you really want to get to a going into deep of it, get all the points, you probably look into that course also. Okay, this will set you the foot into the door, but once you enter that one, okay. So summary of professional responsibility. All right, everyone, let's take a breath. We just covered 28 different scenarios across 10 categories of professional responsibility. That's a lot. But here what I want you to take away. These questions follow a pattern. Once you understand the core principle, you can apply them to any scenario that comes in these cases. Okay. Patient autonomy, educate, respect, and document. Okay. Patient have the right to make the decision. Your only option is to educate them. Documentation, if not education, if not document that it didn't happen, you need to document for the safety of both people. HIPAA, only share protective health information with those who need to know, and that is sent consent by the patient. You need to mandate report cases. Okay, regardless of what is your emotion, what is you think, as per the rules you need to mandate to report abuses and neglects. Reasonable suspicion, you go report immediately. Scope of practice, stay in your lane. Communicate across discipline. You don't want to go above and beyond, right? You within that circle, stay within that box. Billing, you need to operate billing that protect your license. Don't do fraud, man. Don't do fraud. Don't let others also do fraud. You need to report it. Cultural competence, adapt your care to that patient, not yours. If they don't look at your eyes, you need to understand that's their culture and adapt to their language, adapt to their understanding. And teach back method, use the teach back method to make sure the patient understood what you were telling. Workplace safety, you need to follow OSHA and report harassment. If you feel there's sexual harassment, you need to report it as a sexual harassment to the HR. Risk management, you need to report. If there's something goes wrong, you need to report both in documentation and you need to make sure there's an incident report. So make sure that nothing happens again. Okay, even near fall events. Okay, technology, maintain the quality of standards when you give telehealth, regardless of you're doing it, delivering it online. The qualities need to be maintained. You know how the framework to approach any ethical student in NPTE. You will go even deeper on the big three module. Okay, so this was nothing to memorize. This is an understanding of what is the things that need to do. This is a logical question. Now you have the logic. Now we were looking into, all right, so now we are going into the content portion of it, what you need to study, how you need to study. Okay, so this is another day. I know I look different because I'm recording in multiple days. This is a long video, right? So all right, so let's shift gears. I want to talk about how you are studying the content portion for the exam. Okay, so most students approach NPT like this: I need to know everything, every condition, every treatment, every protocol, because anything could be on the exam, right? And that is technically true, but you need to understand, if you try to get everything, you end up with nothing, right? So you need to have an idea of a surgical strike. But here is the myth: if studying everything equally is fair. So people think that since the question is going to come from everywhere, it's better to study everything, so that is more fair. But the reality is that is waste of the time. Okay, now why do I say it is a waste of the time to go study everything? Let me explain why. So NPT is not a random sample of everything you learned in PT school. It is a weighted exam. Okay, so there's a certain weightage carried for each segment or each subject or each topics. So certain topics show up way more often than others. Certain systems dominate the test. So if you spend equal time studying lymphedema and studying knee osteoarthritis, you are making a strategic mistake. Because knee osteoarthritis is going to show up on 10 questions, lymphedema might show up on 1. Does that mean you ignore lymphedema? No, but it means you prioritize differently. Okay, so priority need to be given to things that really matters. You already know this weight for osteoarthritis is more than lymphedema, so you probably need to spend more time learning osteoarthritis than lymphedema. Okay, so here is the truth: the exam is not fair, it is strategic, and the student who pass are the one who study strategically, not comprehensively. Okay, so we need a strategical approach on different subjects. Now what we're going to do is we're going to talk about the big things that you should be focusing on, how to focus on. Okay, so let's talk about where your time should actually go. There are three systems that dominate the NPTE: the musculoskeletal system, the neuromuscular system, and the cardiopulmonary system. Okay, these three systems make a vast majority of exam question. So if you master these three, you are the most you're most of the way there. Let me break it down. So first we are going to be on the musculoskeletal part. So this is your bread and butter. Most of the questions are coming from the musculoskeletal. Okay, orthopedic condition, joint replacement, fractures, sprains, strains, arthritis, back pain, shoulder impingements, ACL tears. You need to know the common diagnosis and the presentation. You need to know the evidence-based intervention. You need to do red flag for each region. You need to know post-operative protocols and contraindications. Okay, so we are going into deeper understanding of musculoskeletal in the big three, but I'm telling you, if you are really want to succeed, you need to approach this strategically, not studying everything and going around and bombing everywhere. You need to strategically pinpoint what should be done. So you need to focus on musculoskeletal. Okay, and then we coming to neuromuscular part. So neuro, you need to focus on your stroke, the spinal cord injury, traumatic brain injury, Parkinson's, multiple sclerosis, GBS, and peripheral neuropathy. These are the content area they usually ask questions again and again. So you need to know expected deficits of each conditions, appropriate outcome measures, the gait pattern, and the assistive device. So gait pattern assistive device is a very important one. A lot of people say that they want to skip it, but I know it's boring, but you need to do it, especially the assistive device also. Okay, let me put a line there. Okay, then you need to know the safety concern, fall risk, and functional goals. Okay, so these are the things you need to be focusing on: high value, high content, and high priority musculoskeletal and neuro. Then you come to cardiopulmonary, the third. So when you see the weightage, most weightage is on musculoskeletal, then comes the neuromuscular, then comes the cardiopulmonary. Okay, so the vitals, you need to know the vitals, how to take, you need to know the exercise responses, You need to know cardiac rehabilitation phases. You need to know COPD, congestive heart failure, pulmonary demand oxygen saturation. So it work around these stuff. There's other things also like ECG and all. So you need to work around these things, and focus should be on these part. Okay. So you need to know what is normal and abnormal vital response. You need to know when to stop treatment if someone's showing any clinical symptoms. You need to know medications, their effect on exercise. You need to know precautions and contraindications and exercise prescription. Now, here is the key insight. Within each system, focus on patterns, not pathology list. Okay. So what do I mean by that? When I say you need to focus on pattern, instead of memorizing every single detail about every single condition, focus on recognizing pattern. What does instability look like? What does inflammation look like? What does the nerve compression look like? What does deconditioning look like? So if you have the memorization of only pathology, you go not going to get a lot of answers correct. But if you know the patterns, 1 2 3 1 2 3 1 2 3, next time you know 1 2 and 3 is going to come, you're going to get it right. So for example, let's say you see a question about a condition you never heard of. You don't panic. You ask yourself, what's underlying pathology? Is this an inflammatory condition or a degenerative condition, a traumatic injury? Then you apply what you know about the pattern, right? Inflammatory condition need activity modification and anti-inflammatory intervention. Degenerative condition need strengthening and functional training. Traumatic injury need protection and progressive loading. Okay, so you need to put everything into the perspective and think what you should be doing in a real case scenario. So that will be the best way to deal with this. See how that works. You don't need to memorize every rare conditions. You need to understand the pattern. Okay, study smarter, not harder. A lot of people do this. They spend a lot of time going through different courses, going through different kind of books for a long time and spending a lot of time. Here is a question I want you to think about. How much time you're spending studying rare conditions that might show up on one question? I call these zebras, rare diagnosis, uncommon presentation, things you saw once in a lecture and never saw again. And here's the problem. Students love studying those zebras because they feel impressive, right? Oh, let me go to that one rare condition, right? It feels good to know about some obscure condition. It makes you feel smart, but the NPT doesn't care if you know about zebras. The NPT cares if you know about the horses. Horses are the common condition, the one you will see in practice every single day. Knee pain, low back pain, stroke, hip fracture, COPD. They're not sexy, they're not impressive, but they are what's on the exam. So here is my recommendation. Follow the 80-20 rule. Huge rule. Okay, spend 80% of your study time on the big three system, the most common conditions within the spend 20% of time on everything else. That doesn't mean you ignore rare condition. It just means you prioritize. Okay, here is the other piece. Master clinical decision making for common condition. Let me give an example. Let's say you are studying knee osteoarthritis. Instead of just memorizing the stages and the symptom, ask yourself, what red flags would make me refer the patient? So you first always go for the safety. You're seeing if this is a red flag, and what will make me refer this patient? What would make me stop the treatment? What is the most appropriate intervention for a patient with a mild OA, moderate OA, and severe OA? What would I educate this patient on? What functional outcome would I measure? See, do you see the difference? It's not memorizing, you're clinically reasoning things on different stages. So first you're making sure there is no danger, there's no red flags, and what is not happening, what is not happening. That's the most bit research-based intervention here. How will I educate the patient on that? How will I get the functional outcome, right? So these layers of thinking need to happen at every question. So when you study like you're taking the exam. Practice applying knowledge, not just recalling. So this is applying knowledge, not recall. All right, now we are going to put everything together, right? I'm going to show you a real practice question, the kind of question that makes student panic. I'm going to walk you through how to approach it using a surgical strike method. We're going to use the surgical strike method. This is the type of question that ruins confidence. You read it, you narrow it down to two answers, you feel completely stuck. Sounds familiar? Here is the question. I'm going to put it on the screen. I want you to read carefully. Okay, this is a nightmare question. A 68-year-old patient with a history of hypertension and diabetes is participating in outpatient cardiac rehabilitation following a recent myocardial infarction. During the exercise session, the patient reported feeling a little dizzy, but insists on continuing. Vital signs shows heart rate of 142 beat per minute, BP of 168.96 milligram Hg, and O2 of saturation of 94 percentage. Right, the patient is sweating but denies chest pain. What is the most appropriate action? So there is some clinical signs patient is showing. Patient is feeling a little dizzy, right? And BP is a little high, feeling dizzy. And what else? Patient is also sweating, but no. Right? And he has a history of what diabetes and hypertension. So, following a recent myocardial, during the exercise session, the patient report feeling dizzy. Heart rate is about 142 beats per minute. What is the first action you're going to take? So, you have an option: continue exercise with the close and monitor symptom. Stop exercise immediately. Have the patient rest, reduce exercise intensity, and reassess 5 minutes. Document the finding. Notify the physician after the session. What is going to do? So, think about that. In a situation like that, what is the first priority for you? Are you thinking about safety? So, okay, so let's walk through what most students do when they see the question. First, you read it, you think, okay, cardiac rehabilitation, post-MI dizziness, elevated vitals. Then you look at the answer and here the panic start. You eliminate D pretty quickly, so you're not going to wait until after a session if something is wrong. So D is out. So this is D, okay? So you are not waiting for things to um, after the session to report something wrong. So most probably you did eliminated the D. I hope you eliminated D, makers. Then you have between A, B, and C. Okay, so you have these three options. You can either continue the exercise with the close monitoring, or you can stop immediately, have the patient rest, or reduce exercise intensity and reassess in 5 minutes. Right? So you're stuck between A, B, and C. Now, A says continue with the close monitoring, and part of you think, well, the patient wants to continue and they are denying chest pain, so maybe it is okay. C says reduce intensity and reassess. That is reasonable, right? So lower the intensity, sees if they feel better, and then. And B says stop immediately. But that feel extreme, that you're completely stopping. Patient insisting they are fine, maybe you're overreacting. So now you are stuck. You're thinking, is this an emergency or I'm being overly cautious? You start second guessing, what if I stop the session and it's nothing? What if I look like I don't know what I'm doing? And then you pick C because it feels like the middle ground compromise, but C is wrong. Let me show you why. So a lot of you probably thought I probably need to go for C because that seems like a good option, but the reality is not that. Now let's approach this the right way. Use surgical strike method. Step 1, identify the safety threat. It's always thinking about safety. That's the first priority. Okay, so your heart rate is 142. That's too high for a post-MI patient in rehab. Blood pressure is 168/96, that hypertensive. Oxygen saturation is 94, that is borderline. Patient is dizzy and sweating. This is not stable. This is a safety concern. Rule number 1, patient safety is always first. So immediately we know the answer. They say continue exercise is wrong. Crossing out, yeah. Apply the logic. The patient is showing the signs of cardiovascular instability. This is a post-MI patient, and patient, that means their heart is compromised and they are at high risk for another cardiac event. So there's dizziness, elevated heart rate, elevated BP, and sweating. That means you need to stop now. It doesn't matter that patient wants you to continue. It doesn't matter what they are denying chest pain. You are seeing objective signs of distress. So the best answer is to keep them safe. So eliminate the compromise answer. Option C is reduce intensity. That's unreasonable, but here's the problem: you're still continuing the exercise and still putting stress on compromised cardiovascular system. This is not the time to compromise. This is the time to stop. So the correct answer, B, says stop immediately and have the patient rest. So that's it. That's the answer. Why? Because safety first, always. You stop the activity, you let the patient rest, you monitor their vitals, and if they don't improve, you escalate. Now, here is the insight. The exam doesn't reward the smartest answer, it rewards the safest answer. Always, always, always go for the safest option. Protecting the patient, protecting your license, whatever it is, the most safe answer. That is the best answer, okay? Option C might work in real life. You might reduce intensity and the patient might be fine. But on NPTE, you don't take risk. When in doubt, choose safest option always. When in doubt, making it more strong. Okay. So here is what I want you to take away from that example. The attendance isn't always the most brilliant clinical decision. It is the most defensible clinical decision. NPT is testing whether you can protect your patients and protect your license, and that's it. So when you're stuck between two answers, ask yourself, which one keeps the patient safest? Which one keeps me legally safe? The answer is, that's your answer, okay? Clarity always beat confidence, system beat motivation. This is a very important thing you should be knowing. And okay, so all right, we covered a lot in this last. Not I was expected to complete in what 1 hour, but this went for 2 hour class. Man, that's a crazy 2 hour. So let's recap what you know now. Okay, you know the rule 3 of 4 ethics and safety. Okay, safety is always first, autonomy matters, and non-negotiables are non-negotiable. You know how to prioritize your study time now. You focus on the big three. Study patterns, not study the specific pathologies. Study patterns that will be able to be repeatable. Master the common conditions, not rare zebras. Look for the horses, not for the zebras. And you know how to approach a difficult question. You need to identify the safety threat. Then you apply the logic, not emotion. Eliminate the wrong answer systematically. So if you are good at eliminating, you are going to end up with the right answer. Okay. So in 2 hours, let me put this one out. In 2 hours, you have learned how to approach the ethic question, safety question, and clinical question differently than you did before. So, but here is the honest truth. NPT has 200 questions and it covers 5 years of PT school. It tests musculoskeletal, neuromuscular, cardiopulmonary, integumentary, and other systems. It covers examination, evaluation, diagnosis, prognosis, intervention, outcome. And right now you have the framework, you have the logic, but you don't have the full system. Now, even with ethics and professional responsibility, there is other things I want you to focus on. Okay, so that will go through the big three bundle as no system, non-system part. Okay. So there's things like OSHA, you need to know the PPE kit, you need to know the content there. Okay, so knowledge base, if you have someone with a knowledge gap and not struggling with the clinical decision making, I will recommend going for that. Okay. So you need to understand what I given today is only chapter 1. That was a completely free, the foundation course. I want you to go through this style. There's a long stretched out class. For some people this can be boring, you know what I mean. You want small class, you need to do it in lot of stretch it out to 12 week. I don't like it. I like to sit there, complete this, and then go for something else. That's how I should be. If you're someone like that, this is the right course for you. Okay, so you have an idea of how things are going on in this NPT now. You know how ethics and personal responsibility questions are going to come, right? So what I given today is only chapter 1, the foundation. But to pass the NPT, you need chapter 2 and 3. And here is what I mean. Chapter 1 taught you how the exam thinks. You need to understand the logic behind the ethics and safety questions, and you need to know what to prioritize your studying on. Okay. Chapter 2 is where we apply this to every content area, and you will truly master to answer trap. That's where we are getting into the real bread and butter. That's where you're going to make a change in life. That's where you're going to get the two answer trap right every single time. This was just a trailer. So I teach you high yield pattern, the common question types, and the decision making framework for each one, the two answer trap, right? And the third one, here we train exam day brain. You are going through intense deep understanding of neuro, ortho, cardio systems and non-systems. So that include ethics and personal responsibility. Again, that has integumentary, that has lymphatic issues, that has cardiovascular, everything that you need to know is there in the big three. Okay, so you and these are under exam stimulated situation, and it's almost like a study partner, since I can resonate with you, that will be easy for you to understand also. So we go through high yield big three and more. So here is a choice you have. You can take what you learned today and try to figure out the rest of on your own. That's completely up to you. So for some people this is enough, and some people might be feeling this not be the right choice for them also, right? That's completely fine. You can spend the next all weeks and wandering through textbook hoping that you're studying the right thing, or you can use the same 10-hour surgical strike I used to finally pass. So let me be clear, I'm not selling you more study hours. I don't want to spend more hours. I'm selling you a fewer study hours with a better result. The students who use the system don't study more, they study smarter. Okay, I want you to study smarter. They focus on what matters, the patterns, the system, not the pathology. So they eliminate the noise. They will know how to systematically eliminate the questions. Okay. So here is what happened next. If you want to access the full system, chapter 2 and 3, there is a link in our web page. You just need to click it. They will show you how to buy that and how to get these things done. So chapter 1 was free. This was my gift to you. Chapter 2 and 3 are where we finish the job. Okay, chapter 2 and 3 where we finish the job. And your license is not just a paper. It's the difference between being maybe you're working part-time 30,000 student to 100,000. You're going to go more than that, once you get the license, so that professional. So that gap is solved by clearing this system, and clearing this exam. This course is going to one course, one answer. Sorry, one exam, one answer, one course. This course is going to help you for that. Okay. So you don't need more study hours. You need a better strategy. That's exactly what this is. Click the link. Start with the chapter 2. Let's finish this together. Thank you for being here, and I will see you on the 2 answer trap course. Okay, that's where we are going to get into the real stuff. Okay, so thank you guys for watching, and this is completely free. I'm going to upload this in the YouTube also, and you can, if you're in YouTube, you can look in the description to get into the course page. Okay, see you there.